Surgical extraction of horizontally impacted maxillary canine.
The authors declare no conflicts of interest in the presentation of this case report.
Introduction. After the mandibular third molar, the maxillary canine is the second most commonly impacted tooth. The etiology of displaced maxillary canines remains unknown, yet hypothesized to be influenced by multiple factors and genetically acquired in nature. The most commonly used approaches are extraction and orthodontic traction, but the most desirable clinical course is early detection and intervention of possible impaction. This report aimed to represent a case of impacted canine management while raising awareness to never ignore the discrepancies observed in one's dentition.
Patient's chief complaint: Doc, sakit na gyud kaayo diri dapita nga ngipon. Ako sad naobserbaran nga tarog ng iyang tupad. Doc, I am experiencing excruciating pain in this area, particularly this tooth. I also observed that the adjacent tooth is mobile.
For the diagnosis of the patient, upon intraoral examination, the presence of a gum boil was seen on the upper right central incisor. Alongside, a mobility test on her lateral incisor was done and revealed a grade 2 tooth mobility with more than 1 mm movement in a horizontal direction. A CBCT scan was performed and exposed a type A displaced maxillary canine.
To reduce the incidence of post-operative complications, drugs were requested to take 1 hour before the surgery. This includes 2 capsules of amoxicillin 500 used as prophylactic antibiotic due to the presence of an abscess in tooth number 11, then 1 capsule of mefenamic acid and 1 capsule of dexamethasone, 4 mg which used as pain relievers, and lastly 1 capsule of tranexamic acid 250 mg used to control the bleeding. For the anesthesia, lidocaine HCl 2% or linospan with epinephrine 1:100,000 was the solution of choice to anesthetize the patient through local infiltration technique. Here are the actual photographs of the open surgical technique with the trapezoidal flap. Figure A illustrates healing axis, Figure B and C illustrate establishment of the trapezoidal flap, and Figure D illustrates successful removal of the impacted canine. After the successful removal of the impacted canine, the flap was sutured shut using chromic catgut. Post-operative medications were then prescribed after the treatment. 20 capsules of amoxicillin 500 mg taken every 8 hours for 7 days, 9 capsules of LEGUIZ 200 mg, 1 capsule taken every 12 hours for 5 days, so thus 11 capsules of tranexamic acid 250 mg taken every 8 hours for 4 days to control the post-op bleeding.
For the patient's prognosis, after a week, a recall visit was scheduled to check the patient's wound healing. The extraction of the upper right impacted canine has a good prognosis with no post-operative problem.
This case report focuses on the surgical extraction of an impacted maxillary canine on a 16-year-old female patient who experienced chronic intense pain on her maxillary right anteriors with concerns about the mobility of the adjacent lateral incisor. The most often afflicted teeth are the maxillary lateral incisors associated with root resorption, followed by the maxillary central, confirmed by previous studies. There are various treatment options for impacted cuspids such as the orthodontic treatment and surgical removal, but as a result of late detection, it led to an expensive and complex surgical removal of the tooth. Trapezoidal flap was used to gain access where the tooth was deeply impacted. Trapezoidal flaps come with the advantage of good accessibility and visualization with good reapproximation of tissue to original position. This study aimed to address that a misdiagnosis of an impacted canine may pose a risk of damage to the roots of neighboring teeth depending on the position of the impacted canine. In the worst case scenario, this may lead to the extraction of the offending tooth as well as extensive, prolonged, and even more expensive treatment.
In this case, regarding function and aesthetics, managing impacted canines is always crucial. The kind and degree of impaction as well as how it affects the adjacent teeth will determine the course of treatment. The impacted right maxillary canine was surgically removed due to the significant risk of damaging the nearby tooth roots. Thus, never ignore the discrepancies observed in one's dentition. Establish early detection, prompt intervention, and well-managed occurrence of impacted canines.